I have two jobs. It's very difficult. I still see patients every week, and at the same time, I lead our team of 200 people.
Hypertension, make sure they're taking their medications, make sure their weights aren't fluctuating too much if they have.
MedNOW Clinics are all over the Denver metro area, and we've expanded into the Colorado Springs market as well. The great thing about Aledade is that it is a value-based care program that allows us to achieve shared savings at the end of the year. And with those dollars, we can reinvest in the tools that we have at MedNOW, but also we feel like we don't have to see as many patients every day. What I try to do is to sit down, put my computer aside, have just a one-on-one, face-to-face, eye-to-eye conversation with the patient. Having those extra few minutes with every single patient really does matter.
All right, buddy. It's good to see you.
Good to see you.
Thanks for coming in today.
If I was a doctor, I would want to be like him. His attitude, his method of operation, his personality, makes me feel better walking out of that office.
We're about midpoint of the year. What we need to do in terms of strategies to move forward.
Aaron Henry currently has about 145 staff over 6 counties. We see about 9,000 patients a year.
Our mission is to provide those services to people who really cannot afford it. This community has a lot of spirit, pride in our history, and pride also in the culture that has evolved. The core mission of Aaron E. Henry is to improve the health of the people, and not one person at a time, but the entire population. Aledade helps us thrive financially, provide more resources to the patients, and grow your practice. The gym is a jewel. Doctors give a prescription to go exercise, but people cannot afford to go to a gym. So our idea was, we put a gym at Aaron Henry. You put a personal trainer in there, and then he's gonna help the people through this process.
Can't get it, y'all.
So we look at the needs of the community and we try to craft programs around those needs. I don't think we could have done as well as we're doing without Aledade.
Well, hello there. Hey, yeah, Mr. Carusi, welcome back.
What defines me as a human being, as an accomplished person, as a happy person going home, is taking care of my patients.
You take care. You too. Say hi to Aunt.
And if I'm in my own private practice, I can deliver that on my own terms. I always like to do things my way. Granted, I got to stay sustainable and successful as a business. Aledade for the last 5 or 6 years have been our saving grace. And Aledade laid the platform for us that helped us do this. All of a sudden, we entered into a savings program that we can get a piece of the pie. Without that big financial reward at the end of the year, there is no way on earth I can be competitive with other institutions. That's why I'm still in private practice. 100% win-win for everybody.